we are back like we never left. It's exactly 16 minutes past 11 a.m. and you're still tuned into Herbalife Radio, shaping minds for a better future. It is still the talk with myself, Miss A and Mrs. A. We are still working on the technical issues, but please do connect with us on our social media platforms. You can find us at Herbalife Radio on Instagram, Herbalife Radio Station on Facebook, TikTok, and YouTube. And also, you can find us on X, which is Herbalife_radio, and our WhatsApp line is 067-153-1089. We do have her on the line, right?
Miss Mpa, can you hear?
Miss Palesa.
Miss Palesa, I'm
calling
calling myself. Miss Palesa, can you hear us?
Yeah, I think she can.
Yes, I can. I can hear you.
Perfect. You were still explaining what it is that you do.
Yeah.
Okay. So as a physiotherapist, as I was explaining, in the Western countries, it's called physical therapy.
Okay.
So basically meaning that you use a physical means in order to treat a condition.
Mm-hmm.
And then I always say that physiotherapy is not new to us, especially the black people, because, you know, if you can remember back in the days when you injured your ankle or your feet were swollen, the older people, they would always tell you to soak it in warm water and put cold salt, or if you've got a painful knee or sore back, you'd always wrap around a towel or a scarf just to give it a warmth and stability. So with that, you've got a condition and you're using physical means in order to treat that condition. So that's basically what physiotherapy is. So we don't use medication, we don't prescribe medication, but we go to the source of your problem. Because the medication, it usually masks the problem. So you might be taking all your pain medication thinking it's better, but it actually hasn't really solved the problem or the cause of the problem. So basically that's physio.
All right. What types of exercises or therapies would be included in the treatment?
Yeah.
Okay, so depending on the condition that you present with, whether it's a muscle sprain or post-op, you've had a knee replacement, a shoulder replacement, or you've been in a car accident, or you've had a stroke. So obviously the exercises are tailor-made depending on the condition that you have. So what we do as physio, which is very important, that's why you spend longer time with a physio than you would do when you go and see a GP, is that you come in and I need to assess you. You tell me what the problem is, but I need to know in my head what is causing whatever problem that you have. Once I know what's causing the problem, then I can tailor-make the treatment for you. We can do the treatment in my room, and then I can give you a prescription. But as I say, we don't give medicinal prescriptions. We give exercises. So someone would think, exercises. But exercises are just as important as the medication that you would take for whatever condition.
True.
Yeah.
Okay, Doc, let's start here, right? I think for me, this is a personal experience also, that I've experienced in my life. Can you maybe define to the listeners what a stroke is and what are the causes of it?
Oh, okay. Yes, absolutely. Okay. So a stroke basically is, in layman terms, it's a brain, what can you call it? A brain attack. Like, when one would have a heart attack, but this one it's a brain attack.
Sure.
So basically, if you can sort of imagine a brain, I'm sure most of you have seen or Googled, have seen a shape of a brain or what it looks like.
Yeah.
So the brain, it needs oxygen and it needs nutrients in order to function.
Okay.
The brain is the engine of the body. So we need the brain to be able to move, to talk, to run, to do all these things that we do. But so the nutrients and the oxygen that feed the brain, they get it through little blood vessels. So when a stroke happens, it's when the blood vessels, it's either they are blocked or they are ruptured. So when that happens, obviously that part of the brain then is starved of the oxygen and the food, and then it slowly dies off. And it takes about 4 to 6 minutes for the brain to be starved of food and oxygen for the brain to die off. And that's when a stroke actually happens.
Sure. My God.
Yeah.
Okay, so now let's jump into the primary goals of physiotherapy for stroke rehabilitation.
Yeah. Okay, so just to go back a little bit, so with the stroke, there are two types. You have the ischemic stroke, which is basically the clot that I was talking about. That one is more common, but it's less severe. So the clinical presentation is not as bad as the other one, which is your hemorrhagic stroke, which is more less common, but it's more deadly. The physical presentation are more severe than you would have with the other one. So now we've had the stroke, and then you go to the hospital and they stabilize you and they do whatever. And then now it's time for you to do physiotherapy. So what does physio do? So now, because remember I explained to you that the part of the brain has been stopped of the oxygen and the nutrients. So which means it no longer functions the way it's supposed to function.
Yeah.
So the brain, it has all those grooves and those dips and all of those things. So each and every one of those things, they have a function in the body. So when they are starved, then they die off, then all of a sudden the person is unable to move their arms, the face is droopy, they get blurred vision, they lose their balance, they lose their speech, depending on the different parts of the brain that was affected. So with physiotherapy and all the other therapies, what we actually do is we rewire the brain. So we use a technique which is called neuroplasticity. So neuroplasticity is basically the opposite of, I'm sure you've heard the term of, you can't teach an old dog nutrition.
Yeah.
So with this, it's actually teaching an old dog nutrition. I mean, not calling people dogs, but I'm just using that as an analogy. Yes.
Sure.
So basically, we sort of have to re-teach you how to move your arm, how to balance, how to move, how to walk, and so it's a process. It's not a sprint; it's a marathon. So you have to attend all your sessions accordingly. But I mean, obviously, there are a lot of constraints. Some patients aren't able to attend all of their sessions and whatnot.
Yeah.
But basically, that's physiotherapy does.
So,
for patients. Yeah.
okay. So let's get into now for a person that has had stroke, right? How will you as a physiotherapist, my God, my English is back. How will you as a physiotherapist plan a tailored, should I say, tailor-made plan for me as a patient to make sure that I am well back to my feet again? How will you be? How are you planning on creating that plan for me?
Yes. Okay. So as I said to you initially when I started explaining about what physios do, so with the stroke patient, it is very important, absolutely crucial to do a thorough and a proper assessment of the patient.
Okay.
Because as much as you can have 10 people with stroke, but none of those 10 people are the same. So I can't treat Mrs. A the same as I would Mrs. C because they're totally different. So I need to see the physical limitations or the physical abilities, and then I need to work on that, because you might find there's a stroke patient who absolutely, they can't move. No matter how hard they try, they just can't move. They can't roll themselves in bed. They aren't able to sit themselves up in the bed. And then you have another stroke patient who they can sort of hobble along. The balance is a little bit off. So obviously the treatment plan for the two patients, they won't be the same. The one is a little bit more of a far higher function, and then the other one is a low function. Obviously, the aim is to restore function, so to get Mrs. A to be as functional and as independent as possible.
Okay.
Sure. And then, Doc, Miss Palesa, what do you guys consider a severe case of a patient that has had a stroke?
Sorry, can you just repeat the question?
Sorry, my voice is a bit. I was saying that what, as physiotherapist, what do you guys consider a severe case, like of someone who has been hit by a stroke?
Sure. Okay. So severe case, the two common ones is pressure. So you have people around not knowing they have high blood pressure, or you have people who know they have high blood pressure, but they're not taking their chronic medication because they feel
yeah.
that and stroke. So the time you have because pressure is so elevated. It's not
Palesa, please can you move around for us just a little bit because your line is not so good. It's now getting bad. Try and move just slightly as you're trying to.
At an angle.
Yeah, angling an
Okay.
80
Okay.
Yes, we got you
Alright,
now. We got
now.
you. We got you now.
Okay, can you start from the top?
Oh, okay. Must I say that again?
Yes, please.
Yes, please.
Okay, so as I was explaining, with the two types of strokes that you get.
Yes.
So the second one, which is less common but is more deadly,
Okay.
is when you have burst blood vessels, right? So the burst blood vessel, the main cause is elevated blood pressure. Elevated blood pressure. So you have people walking around not knowing they have hypertension, or they do, but they're not complying with the medications, they default.
Okay.
And then what happens? And then they get the stroke. And then if they continue not taking the medication, then the chances of them getting another stroke is very high, and another stroke, and another stroke.
Yeah.
And before you know it, the person's got a double stroke on both sides of the body, all because they were not compliant with taking the high blood pressure medication, which is very, very important.
So how oh Jesus. Okay. So how should a patient expect to attend physiotherapy session?
Okay, so for me personally, I've worked in private for the last 15 years. I'm not quite sure how the public service works.
Okay.
So, but in the private, when a patient has been admitted in a private hospital, it's almost protocol for the hospital or for the doctor in charge of the patient to send them to a rehab center, a physical rehabilitation center. And there, obviously, they will get extensive physiotherapy, occupational therapy, speech therapy, whatever therapy that they need, and they will stay in. So it's a live-in facility, and they will stay in anything between 6 to 8 weeks up until they have reached all their goals that are possible, or the medical aid is kicking them out, and then they go home, and then they'll have to come in as outpatient. So now, as an outpatient, also depending on your condition of the severity, anything between 2 to 4 times a week is recommended. And the first 6 months of having had a stroke is a clear indication of your prognosis. So in other words, if you've had a stroke and you progress within 6 months, then we know that there's a good chance that you will reach your potential as much as possible. But if after the 6 months you really haven't achieved a lot, then your prognosis is a little bit poorer than somebody who, who's higher functioning than you.
All right. Let's quickly do this.
Yeah.
Please do stay on the line for us. We're going to pay some bills. When we come back, we'll continue with the conversation with you.
Okay, no problem.
Get up in the morning and invite good things into your life. I am blessed. I am strong. I am talented. I am disciplined. I am focused. I am prosperous. Take what you have and make the most of it. God made you like you are on purpose. He gave you your looks, your height, your skin color, your nose, your personality. Nothing about you is by accident.
Get ready for the Sunlight Replenishment Concert with 14 of the biggest artists. Live on stage, the iconic Rebecca Malope, Sbu Noah, Leus Khobela, Dr. Tumi, Tumi Mkokstad, Tu Kabelo, Bugalav Mapelani, and yes, many, many more. Tickets selling too fast right now at Ticket Pro. See you on Saturday, September 28th at Centurion Supersport Park Stadium. All in partnership with Touch XP.
Gospel Goes Classical Decade Celebration live at Carnival City featuring Timothy Myeni of Nandweni, Lusanda Beja, Ayandan Danzi, Genelwa Home, Snezzy, Colin Maluleke, Dakindo, Once More Sick, Yanga, Ola Toto, Banele Santos, Dogo Zongongoma, and Muso Worship. the 26th of October. Tickets available at CompuTicket. #Jesus the Messiah.
It's exactly 11:31 right here at Herbalife, shaping minds for a better future. You are still tuned into the talk with myself, Miss A and Mrs. A, and we're here to keep you company. Before we went into the ad break, we were talking to Miss Palesa, who is a physiotherapist, and she's still on the line with us because we are yet to continue the conversation.
So, Ms. Palesa, let's get into this, right? Kicking right through, let's say that we've been in with a patient that has been living in, and earlier on you spoke of the fact that it's either the medical aid would say, you know what, something like that, right?
Yeah.
Or I as a patient, right, I am doing so much well that I'm responding so well to the therapy itself, and then it comes a time whereby you see fit that you can go home, you can come in from time to time, right? So now from the discharging moment, from being discharged, going home, what is it that people that I live with can support me with or help me within the household to recover much better as well?
Okay, right. Great question. So normally what we do, so in a hospital setting or in a rehabilitation center, so prior to the patient being discharged, we'll call in the primary caregiver, whether it's a husband, a wife, or somebody that the family can hire. And then we need to teach them. So we need to train them and we need to educate them. So they need to know what a stroke is, what's happened, because sometimes you find that when the family members, they don't really understand what it is, then they will be very offish and they will give very bad support to the patient, and obviously that will impede on their progress. They'll do so well in therapy, and then the minute they go home, they're just sitting, and you're wondering, but you were doing so well, not knowing that when they get home, then it's like, come on, you lazy, hamba, all those things, and not really understanding that. As much as the patient wants to palama and hamba, they just physically cannot. And you, as a caregiver, you are there to assist them so they can do all that palama and hamba things. And so family support. I can say I've got a client in Davidson in one of my clinics.
Yeah.
And this lady, she's got the best medical aid money can buy. But you know what the problem is? The support. She just does not have the support that she needs. Her kids, they couldn't give two hoots about her. There's only so much I can do as a therapist because I'm only with you for like 45 minutes to an hour. And the minute you go home to that environment. And if your kids are calling you names, calling you lazy, you're going to want to give up. And you think, what's the point of doing anything? And then, so it's very important that you get the support that you need from your family members. And as a patient also, you also want to impress them because you'll be doing something and then you're able to stand for like 5 minutes and you'll be like, and the patient will be like, I can't wait to show ban. That excitement, I want my family to see that I'm trying, that I'm doing. But if you as a family member, you're not seeing that effort, then it just cancels everything. So,
So, Doc, in your perspective, right, in as much as there is the help that, like physical help in terms of, doing these exercises with them, what do you think is the most important, or the top of the list important kind of support? Do you think it's first an emotional and mental help first? Emotional support first, because you did mention how, they will get home, or they'll have the best medical aid and stuff, but when they get home, they are being called names, they are all of that, and then as a result, that person will end up giving up, So do you feel like emotional and, mental is more important than,
So I think, I think emotional support, spiritual support, whatever kind of support that you can get, other than the physical that you with the exercises and the family develop. If that is intact, if that is in place, then everything else falls into place. And I've seen it time and time again. And this lady that I was talking about, there's also another gentleman. Also, he's got the best medical aid money can buy. But when he gets home, the wife just couldn't, she just couldn't care less. It's like, no, just do whatever. Then it really, it sets you back, and you don't even want to try anymore because it's like, what's the point of trying? So I think emotional, spiritual support is very, very important. It's very important because all the other things like your physical activities, that is something the patient can do themselves because obviously that's a point of therapy. I'm teaching you to be able to move your hand. It's not me moving your hand. The hand itself must move itself. So the physical part, the patient can do on their own themselves. But the spiritual part, obviously they have to feed off whoever is around them, whoever's surrounding them. And that's just as important. It's not more important.
And then, Doc, for someone that has experienced stroke, and is in the process of physiotherapy and all of that, how can that person or the family measure progress within the stroke rehabilitation?
Yeah. Okay. So basically progress. So as I stated with the assessment and whatnot, so once I've assessed you as a stroke patient, at the back of my mind, I know the goals that I've set out for you.
Yeah.
So obviously sit together with the family and the patient, and then you say to them, these are the goals I think are attainable, are achievable. You always have to be realistic. You can't expect a 90-year-old man who's had a severe stroke that in 2 months and he'll be, tending the garden. You have to be realistic, and the family as well, they have to understand the severity of the condition. So with that said, then you would, if the patient is very severe, then obviously you look at your low function levels, like being able to roll yourself in the bed, which is very important because you need to move so that you prevent a pressure sores.
Yeah.
And then being able to get yourself up from lying into sitting, being able to sit up without being supported, without leaning on the headboard, or without people propping you up with continental pillows. And all of that, once a patient is able to do that, that always, it's a step ahead or towards independence. Because if a patient is able to move themselves in bed, then they don't rely or depend on somebody else to come from wherever they are to come and turn them. They can turn themselves. They can sit up on their own. They can sit without being supported. Then they can use the unaffected hand to feed themselves, to wash their face, to brush their teeth, and all of that. And then obviously once they get stronger, then you start with the standing. Work with the standing. Is the patient able to stand? Are you able to balance? Can you move while you stand? And then once you're able to do that, then you start with the walking and etc. So it's a step-by-step function. It's not just, one exercise program fits all.
Sure. All right.
Yeah.
Oh, what information today, ne? What information we've had on the show. And last question before we let you go. How can we adjust, or you rather adjust the plan if a patient has relapse?
Mm-hmm.
Yeah.
Okay, so that's quite common. So obviously the first thing to find out, to investigate, is what happened, what caused the relapse. Did the patient have another stroke? Why did they have another stroke?
Yeah.
What is the family or the home situation like, the social situation? So you have to look at all those other factors first, and then or maybe it's a medical thing. Maybe the patient had a cardiac arrest, or they had a diabetic ulcer, or anything.
Yes.
So you have to look at that, and then you have to obviously try and fix whatever caused the setback. Because if you don't, then the chances are, they will sit back again. Right. And then once all of that has been stabilized, then you can go back to assessing again. You have to reassess and see if the patient is still at the same level they were the last time you left. If they're worse off, then obviously your treatment plan changes. If they're the same, then you continue. If they're better, which is a good thing, then obviously you continue from there.
All right, this is Palesa. We have to wrap up the conversation, but I have to ask you this question, right? I once heard
Yes.
that somebody once mentioned that they had a stroke, and then somebody that was within the family then could not take care of them, and then they relapsed. When they relapsed, now it was up to the doctor and to the therapist that recommended that literally they cutted the family members from interacting with the person for about I think they said 6 or 8 months. But now my question is, if you see it fit as a physiotherapist and as a doctor, are you allowed to literally do that for the sake of the person for the sake of your patient?
Yes, you know what? It's always, I mean, us as medical professions, we always look at our clients first. Okay. Whatever their needs are, their needs come first. Okay. If it means we cutting off the bad whatever, then so be it. Okay. I mean, obviously, we have to do it within the legal limits.
True. Okay.
That's when we would involve the social worker and all the other medical professionals involved. But certainly, that is very possible, and that can be done.
All right. Thank you so much. We'd like to take this opportunity and say thank you for coming through and giving us the information that you came with this morning. May God bless you, keep you, and give you more strength.
Okay, no problem. Thank you so much. Thanks for having me. Thanks to